is a man who comes from the practical side regarding your people's back, Sebastian Authenrieth. He has been training with clients for many years in back pains. He is out there worldwide en route for training, further training, working with people, and he also was one of the co-authors of the EMS book, this thick book. He is very much involved in practice and theory, and he will talk about back training with EMS. How can you use it in a reasonable way, build it up in a reasonable way? He will also elaborate on various training levels and then give you a tool for back training based on EMS. Sebastian, you have the floor. Well, this particular topic is a highly specific one indeed. And I started with lowering my voice because this is the way I start a trial session with a customer who is suffering from back pain in my studio. I have got a few major points I would like to deliver to you in the next 30 minutes. We are playing with the most valuable asset a customer owns, and it hasn't got to do with their homes, their cars, their vehicles, but with their health. And the older we get, the more important it becomes, and the better we understand. I'm 32 now. It starts with me too, that your health declines. I come from competitive sports. When I train my athletes, I cannot show them how to run at this level. It looks stupid and my body can't take it anymore. But I know that I was even better, be better than them, and I managed to do so. And the same applies to your back. And when I'm 25, 35, and 50, and I try to grasp the last straw, hit the next studio, whether I'm talking about fitness, EMS, or other sports methods, we have to be aware of one fact. Our counterpart really gives us something highly sensitive to deal with, and it has got to do with emotions. And this leads us straight to today's topic. I'm very happy to be here to talk about this to you. It's a series of presentations, so you can take a look at the first two parts of this presentation. It will also assist you in your endeavors. Shouldn't you have watched them? It's no problem. So it's 100% understandable for you when I do a good job. This is why I'm here in the first place. Okay, we will link this with fundamental patterns of movement. You see that is point number 8. So who am I? What am I able to do, capable of doing? I'm talking of myself as a trainer, as a person. I have to ask, am I able to provide what the client wants from me, wants me to do? And I have to answer this question because what I'm playing with is a person's health. Mr. Filipovic, he is playing with the career, the life, the job of his athletes, and I'm playing with the health of my client when, back problems have motivated them to approach me. Am I a trainer? Am I a therapist? Am I a doctor? And now I have to see what types of back problems the client is suffering from. Is it fascia structural problems, muscles, tendons, capsules? Is it a psychological level, or is it, the bone structure as such? And I, as a normal trainer, can not do this. It would be 100% speculation. It would be irresponsible to say that I am capable of doing that and say, we are going to make it. We'll do it in 20 minutes time. You will have gotten rid of all your pain. And when you take the 2-year subscription, I give you the training underwear for free. Well, this is incompetent. I need a therapist. I need a doctor to check what's wrong, or what is the cause of this pain. And then they're highly competent instructors and trainers who can work on the basis of this information and then develop the right targeted training for enhancing the situation of the patient. And it's a pity that those who've got this major knowledge, well, they only find out slowly what EMS can do in relation to back pain. We've got great therapists in Germany, and this is an area that is still, well, in a deep sleep. Whether we are talking about therapists, physiotherapists, I want them to wake up, the doctors too, and say, oh yeah, here I've got a wonderful discipline that may all let me make advances in my own area of work. And whether there's a trainer or a therapist at the end of the day, I don't care. When it's meaningful, when the thing is competent, it's a good thing to do. And there are some limits, and we come up against where we cannot provide assistance. If I want to make all my customers happy, then I would sell ice cream. I also have to know my limits, and we are still learning. All of you's got a possibility of doing so. We are in the year 2019. Everybody can learn whatever they want. Well, I'm 32, but I'm thinking about adding a bachelor, a master in another area of study to expand my knowledge. Everybody in this room is able to do that, no matter how young or old, but then apply the competences and skills accordingly. What does our customer want? Not EMS training, but quality of life. This is what they would like to gain. Freedom from pain, and our clients would like to feel better at the end of the day. When you really suffer from back pain, I had, a pain in the lumbar region for 3 weeks. I couldn't put on my shoes or my socks, and then it's cool when somebody does it, and then it starts hitting you in psychological terms. It's my ego. I'm out there, on the suburban railway, and then I have to ask somebody I don't even know whether they can tie my laces, and this is an emotional matter. It's not fun either, and your clients won't talk about this, but gradually this will come out and see the light of day. You cannot move, you cannot do your job. After 3 months of being off sick, your boss gets nervous, and then your financial subsistence is, challenged, and you, might suffer a risk of losing your jobs. But where we are here in Germany, thank God, we are relatively safe there. There are safeguards, but in other countries, we might also have people from other countries here where this is not the case, and it hits my own, ego. I do not want to make you sad here. No, I would like to leave you on a positive note and tell you there is something, when we apply it correctly, to actually assist people who have been suffering from enduring problems. And this is our task. This is our calling, so to speak. And training is a systematic, a targeted process that is to bring about an increase in performance. I cannot do just any type of exercises, for people without back pain, sporty people or not. I have to take a close look at the customer. Which exercises movements can they do? The spine is one of the most mobile structure in our body. We can extend, we can flex, we can rotate to a different degree in the various sections. And ideally speaking, it should be when we are free from pain. And this is our task as trainers. And we have to work and see what client is standing right in front of us. Then we have to find the right, dosage level. Each and every back pain client is going through different patches. Sometimes they are better off or worse off, and often, in addition to that, they've got an accompanying therapy to your work. Once your customer undergoes therapy, we are an accompanying measure, in my opinion, because there's a therapist, a doctor in the background who says something is wrong right here. And when I sent my customer to physiotherapy at 3 in the afternoon, manual therapy, and the physiotherapist, has been then kneading the spine for 20 minutes. And the last 2 minutes, he asked the patient, what are you going to do now? And they say, I'm going to hit EMS training now. Well, the physiotherapist, what will he say? Great, wonderful. What I've done in 20 minutes with, a lot of diligence, you are going to destroy, in about, 15 or 20 minutes. So we have to bring structure to it and plan in a meaningful way. It would have made more sense to, go about this the other way around and start with EMS, and then the two sides could have done a better job. And this also forms part and parcel of the work of the instructor, asking, hey, what are you doing over the week? Are you still undergoing therapy? What is the therapist doing? And then we say, okay, we set a time for the training, which is quite right here. The EMS training can be subdivided into 3 different areas. This is the strength training, endurance cardio training, and relaxation-based training. Cardio training I left out quite consciously, because cardio training gets quickly dynamic or explosive. The high intensity level, this is to ensure an advantage of EMS. And once I'm suffering from back issues, then quick dynamic movements in most of the cases are uncontrolled or are subject to much more risks, so that we have an adverse change to the structures. So right at the beginning, we say, quite definitely we leave this out. So what we focus on during this presentation is the strength-based training and the body relax, and we have to look at this as possibilities of working with our clients. These are our assignments. When it makes sense, intensities, repetition sets, break times, and training frequencies. This is our variable. These are the variables to deal with. First of all, I have got this visual check of the customer. When the customer, enters the studio, I can see it judge from their faces when I'm an emphatic trainer, asking, what was your week like? And he said, last week was better, or last week was, I was worse off. I had a relapse. And without studying sports, when I'm empathic, I can then handle the parameters there at the bottom. And when you said, I suffered a relapse, it's a logical consequence that I lower the intensity of my training and, don't just go for it in an uncontrolled way. But for doing so, I require the information. And this applies to all customers. I just take a look at them, check what their last week was like. It's indispensable. You can put it into friendly words. You are up to date, and you prevent complaints or adverse impacts. So, and this is what a typical week looks like for a client that suffers from back pain. In this particular case, we do have a high work-intensive plan. The blue phases would be work times. And when you then transfer it, to somebody at a management level, it's a normal week, I would dare say. Running to reduce stress, boxes, and he does it in the morning because in the evening and afternoon many things can happen. And I would set the dates in the morning to have a safe date. Whenever you've got business people and have got dates in the evening, it doesn't work because business comes first, and when there's a business meeting, you are the one who's going to lose out. And if we do not continuously apply the training, we won't have the desired effect. So when we do something, customers have to come once a week. Interesting, thing. 2 weeks ago, I had a dog for 4 days, and after 4 days we were all dead because at 6 o'clock he woke. How often should they go out? A normal dog, 2 to 3 times a day you should go for a walk, a minimum of half an hour each and every day. Why? Because otherwise they are barking, their joints deteriorate. I have to pay more for a vet, and I want to do something for the cardiovascular system of the dog and the figure of the dog, because dogs love food. And how do we treat ourselves as human beings? What is our normal movement dosage for people? Next month, because we booked our holiday. Yeah, all of us are not fully strained and stretched when we sit on a chair all day long. We also gain weight because we also love food. We are also going to suffer health problems, but we pay it on a monthly basis. We pay our health insurance. And so when you go to a vet, it's more difficult to do so, emotionally speaking, than when we go. It's an all flat. We've got a flat rate when we are there, and we pay it. And the more we we use it, the more we get in terms of a service. Therapy, it's not on there because I don't know. I don't check it. I have to inquire about it. Is this particular patient undergoing therapy? And if yes, what is being done? This is the information I require. And should I not have this information available, it's difficult for me as a trainer to come in a meaningful way. And now we come to talk about competence. And when we gap the bridge between the trainer and the therapist so that we finally talk to each other, then this methodology is going to win at the end of the day. I'm firmly convinced of that because for 7 years in my studio, I've seen what you can do in terms of positive things. It's a lot of work involved, but it's fun too. Then you've got a client. A client is always at the very center of attention, and we do have 4 categories, and they also come into play with regard to back pain, but you could transfer it to other areas too. The expectation of our client doesn't only have to do with training, but there we've got also the diet, mental state, and regeneration. Mark Verstegen from America says 80% of effect is gained in the period when you're not training. Regeneration period, only 20% of the effect is gained during training period. Well, EMS, there we've got even less training period because it's so intense. And now we are training specialists, first of all. But when I look at this particular slide, I see when all the 3 fields are gain color, it wouldn't be any problem. I have got partly customers with a perfect new diet, but they don't do any sports. So I don't have to work in the field of nutrition and diet. I can tick off this box and I take care of the other 3 areas where the customer is less competent. But I have to know which problem areas I'm confronted with. I've got my cooperation partners in terms of nutrition and a dietitian. I've got my partners and I sent them there. And regarding back pain, food, diet plays a major role. I do not want to open this discussion, but we can do a lot in terms of the diet. Our core competence is training, and training as such is also subdivided into subcategories. What can my customer do? Is it due to a lack of strength, a lack of endurance, a lack of cognitive skills, balance, stability, or the quality of movements? Is the client restricted in terms of movement? I have to be aware of that. Once I know it, I can structure it and I can quite consciously work in some areas and see whether my customer situation improves. And this doesn't even take 5 minutes in terms of documentation, and I would know what my client can do. This is in a file. It's encoded and no name, and so a trainer can see what do I have to work on at one glance. And here I'm not going to work in the endurance field with the customer because they can do it. At one glance I see it. I have got some issues in terms of quality of movement and cognitive skills and strength, and I can nicely associate it with EMS training once I've got a clue of what I'm talking about and I'm well trained. When people try to have protective posture, I have to break through it. We would like to have a positive change based on then movement. When I tell my client run another 20 minutes every day, I can do it in support of the rest. And then as a trainer, I'm responsible for the effect because on their own they wouldn't at the 20-minute odds of running. A positive reinforcement. They need motivation, and as a rule, they have tried quite a lot and haven't seen any effects. So this is positive thinking, and this is also part of what we do. We would then have a positive condition. We would like to deviate them from pain, get better sleep, which leads to better regeneration qualities, and which has got an antidepressive impact. Depression, a major issue for people who've been suffering from back pain for a long time because they are restricted in dealing with their everyday lives. And then fundamental patterns of movement. people do have 6 to 7 fundamental patterns of movement: getting up, sitting down, have to run, move forward, backward, be able to bend forward in the hips. It should be shifting, drawing something, and stand upright. And when you tick off the boxes, when you've got people with strong back pain, you will not be able to tick off a lot of these boxes, and then you have to work in these areas. And now I would like to give you a brief insight. I will then work with a test person in practice and show you the approach I use for EMS training when I do have back pain clients here and work in terms of back pain. We have to adjust intensity to the daily situation of the customer. We would like to strengthen the back as best possible on this particular day. The focus is on a correctly performed exercise, because otherwise we will do more harm than good. And after each and every back exercise, we have got an exercise in an upright posture, because when I have somebody stand there for 15 minutes in a bent position, it will also harm the back. We first of all work in a static way and then move on to the more dynamics. We would like to learn feedback when coming with a good position. Often people move into a leaving position. They said, when I turn too fast, it hurts, and then they move around like this and don't move any more and turn any more with their back. This has got something to do with positive reinforcement. We have to see, okay, where does it hurt? We stay in the positive area, and so the range of motion increases from training to training. Intensity, increase in intensity. When I want to build in muscle strength, I need high intensity and weight, and this often would require long preparation time. I need 2 to 3 months until clear and squat can be done under load, and EMS training doesn't require this. This doesn't mean that we should never ever have conventional strength training. It depends on the diligence of the customer and their motivation. Then I should move also into some load weight bearing training with weights. Well, my dog example, 20 minutes of training per week is better than nothing, but for a human person, as a holistic approach, we could do something, a little bit more, if I may say so. Intensity on a scale of 1 to 10, you need a scale of 6 to 7. And by standing in various positions, we would like to increase the competences of our customers, and their break up the relieving positions. And now we get our next speaker as my test person. I would like to thank him already. I would like him to ask him to assume the basic position. And before I move up and increase the stimulus, what about your back? What does it feel like? Wonderful. Okay. He's got problems in the lower, lumbar areas. He just heard from me. You will bend forward a little bit. Stop. Yes, straight back, and now your back pain should be about to start. So if he moves forward a little bit more, he would have problems. Now it's still pain-free. And now as a trainer, I say, congrats. This is today's position and posture of bending forward. So ideally speaking, in about 6 months' time, it should move down with a straight back to this position and should look like this. So there's plenty of work ahead of it, but no problem. We are going to tackle it. This would be the basic posture. This is where I start my control. I set the limit for myself. In the next 20 minutes, I remain in this range. Up and down, it would be a squat. I know that, Parner can do a perfect squat, and, he can show this. This would be the basic pattern of movement number 1, up and down. This helps him in everyday life to get up and down again, sit back. Then we bend forward. The next movement pattern, this is then you bend your torso from the hip, so your back side stays there, and the movement is, if possible, only done from the hip. As a trainer, I support that. Your tip. If the customer comes with back pain, I can be empathic with my hand and can also then work in the target muscle group, and that will give him the immediate feeling that somebody is taking care of the area in question. Somebody is there for the back, and Bernhard is doing a super job. Well, one leg forward, the other one forward, the other one back. This is like a movement pattern when you walk, and a wide step will be more problematic than a short one, and this is why you see people suffering from back pain while using short and quick steps in the pedestrian zone. The back is okay. Wonderful. So a little bit more forward, still free on pain, but still no pain. Fine. So we have 1 centimeter. So even during the training session, check on the current mood, this mood management. Then go back to the basic position, shift it away, arms put forward, and then back again, because these are exercises and movements he needs in everyday life. Here, one possibility is stability, which comes in, and mobility. Mobility is there. He can still bend forward a little bit further, tilt further, and once I've got this one-dimensional load, I add minimum pressure on one side. Then the other side has to stabilize that should the back remain straight. So minimum pressure, I make sure that his posture doesn't change 1 single millimeter. And so I have the rotation component included in the basic movement, where this helps him in terms of stability to intensify this area more. Everything fine. Okay, same exercise. Then drawing would also be there in each and every other one. You can also build it in. We come back to that when we associate basic patterns of movement. Then upright posture with a one leg stand, one leg goes up. The diagonal arm moves up diagonally, and then here you have to be very careful. You have to correct a little bit higher. The toes also move up, abdomen fixed, firm, slightly bend standing leg, and keep it a little bit higher. And this gives me a 0.0 tolerance in people with back pain. When the exercise would be better, I want to ensure that they are doing it as best they can, and they get a feeling that I'm working on them and their problems. So thank you very much. So this was a tiny little insight. Moving in detail into each and every exercise would go beyond the time slot here. As a free lecturer, we've got a 2-day level 1 training. You are cordially invited to attend, also in English. You can find it. And should we be the wrong partners for you to turn to, then try to get further qualifications another way. Do me and your clients a favor and do it. This is a huge topic. Be competent, be qualified, and should this not be the case, try to acquire the skills, because you are playing with your client's health. Should you want to contact me, feel free to do so. Otherwise, I would like to thank you very much for your time, because this is the second most valuable tool. You own the time you've given to me, and I would be very happy if I was able to give you a few new pieces of information. I'll be available outside at the table for further discussions. I hope that you've got a great stay here at FIVO, and all the best to you. Thank you.
Thank you, Sebastian.